The activities mainly implemented by the regional directors during the LMD include, I would say, three components. One, pre the LMD itself, the LMD activities itself, and then post LMD. So for the pre, we are looking at things like the LMD meetings, the pre-LMD meetings that happen at the state level with the LMCU. We're also looking at the engagement with all the stakeholders, especially the implementing partners, the LMI's reports collection activities, the LMI's data, and so forth. By LMI's, I mean the Logistic Management Information System, the data entry into the National Health Logistic Management Information System platform, the review, the validation. So all of these actually involve coordinating personnel, mobilizing resources, and ensuring that these are done according to the prescribed timeline.
So what it involves in LMD is first is data on commodity received within a particular period, what is used and what is left. Such data generated at the health facility and is put on the reporting tool has to be transmitted to the state LMCU through the local government LMCU. There is a national platform called the Nigerian Health Logistic Management Information System, initially called Navision, which all this data on programs like HIV, malaria, family planning are entered onto. And as it is entered, all stakeholders at the different levels, state, national, and the local governments have viewed that.
Before we commence any LMD, there's what we call the long haul. Long haul is the pre-LMD activity. This is the movement or positioning of bulk commodities within the zonal warehouses to service each LMD during each and every cycle. So one of the things we look at for one is first of all to share the ASN, which is the Advanced Shipment Notification, with the warehouse and the transport 3PL. The issuing warehouse, first of all, looks at this order and confirms it with what they have in the warehouse. So they do what they call pick and pack and position of these commodities at the staging area, which they hand over to the transport 3PL.
After the confirmation of these items, following the name of the facility name, down to the product name, the product description, the batch, the expiry dates, and quantity. Once everything is okay, we'll now hand over the commodity to the transport 3PL. The cartons are being sealed properly. They are all properly labeled and loaded into the vehicle for onward delivery to the health facilities.
Once the data is faulty from the source or from the primary level, then the decision made thereof might likely to be faulty. So data quality issue is a very primary challenge to the LMD process.
Most of the challenges tend to fall around the issue of the dispatch, or when I say the post report collection period. So for instance, we have commonly inadequate truck deployment. So the commodities might have been picked, they might have been packed, but we may not have enough trucks on ground to move them out as and when due. Again, we also sometimes have cases of inadequate personnel to ensure rapid handover of these commodities to the 3PL, the distribution 3PL. That happens once in a while as well, and slows down the rate of dispatch and delays the LMD.
Vehicles that are used to convey some of these commodities into the state sometimes are not the vehicles that are finally used to get to the last mile during the delivery. We also had issues with having facilities recording incomplete commodities, and therefore having issues with not signing the PODs. We have also had issues, challenges around proxy deliveries, where we have a 3PL delivering commodities for a facility at another facility. Then there are issues sometimes around security challenges in the states. About last cycle, we had issues with delivering to some local governments due to the security challenges in those local governments. Another challenge to the LMD process is during the last mile delivery itself, which is very difficult terrain, ranging from the riverine areas, the bad roads, and all of that, and health facilities that are almost inaccessible due to this difficult terrain. So it's a whole lot of problem, but we still strive to get those commodities to those service delivery points. Then the other one is commodity shortfalls. Sometimes it happens at the global level due to interruption in their manufacturing process. I'll give you an instance that affected the project sometimes last year, when some of the manufacturing plants that were supposed to be used in manufacturing other RTKs, rapid diagnostic test kits, we are now reconfigured to manufacture COVID-19 test kits and other consumable and reagents, because it was a public health emergency at that point in time. So, but it then affected other commodities in country.
We have LMD commencement meetings with our 3PLs where we have to restate the expectations, clarify our roles, and agree on strategies to mitigate some of these same recurrent challenges which I had mentioned before.
Most of the time it has to do with the healthcare workers not properly capturing this, or not knowing what to do, or the particular data to capture actually. So this has to be a joint approach. Both the government of Nigeria, the implementing partners, and the GHSC PSM, USAID contractors, to continue to provide orientation to these health workers on the primary data that are needed, and the very essence of and importance of having this data in complete and accurate manner.
Okay, so in Akwa Ibom State, we have over the past 3 cycles increasingly had the participation of the state LMCU and other state actors, which has ensured that we are able to resolve issues like facility focal persons not being around at the facility, or having challenges with the 3PL due to timing. We have been able to resolve such issues more easily because the state LMCU have been able to actively engage the leadership of the local government health care system, and also the state level healthcare system on days of deliveries, and actively engage the facilities focal persons to know that they are not supposed to receive commodities after work hours, no matter the pressure from the 3PL.
When we started this whole process of last mile distribution, the things were done manually. Now everything is one network electronically. There is more visibility into the process. They are seeing our warehouse right from the central control room. So which means that there is more visibility into the process. What is happening here is being seen directly at the control room. That is a very big, big achievement in this project?
Recently, we commenced the use of the EPOD system, and the functionalities that it held really showed us that if we really operationalize this system fully, the in-process monitoring will be better. Perhaps the turnaround time for processing of payments for the 3PLs will also be shorter. Again, there's also the chance that we can use more of the state LMCU to even use the EPOD, because if we intend that they should own this process, then it's also very helpful that they also work with this tool that is so highly advantageous. It may help them to own the process even better. The successes of the LMD so far, from the angle of the region, we have consistently ensured that most of there's 100% adherence to the prescribed timeline for the pre-LMD activities.
We are always having a 100% coverage. If, for example, we have 443 facilities that were to be resupplied malaria commodities, there's always that coverage by Chemonics, and is always done, so no facility has ever been left out.
In one of our states, and that is in Ebonyi State, where the local government officials collaborate with our team in ensuring that LMD infringements are minimized, and they do this by accompanying the 3PLs during the deliveries. What this does for us is to help them own the process even more. They also help us to flag issues quickly and resolve them very quickly.
There is a platform that is called PSM Technical Working Group, that is called Procurement and Supply Chain Management, or we call Logistics Technical Working Group, which the GPS is the chairman of that technical working group. So it's a supply chain technical working group where all the stakeholders in the state are part of it. That technical working group actually now brings about ownership and sustainability by the state. So where there are anything that needs to improve that is being discussed, so the state already has a mechanism that has been put in place, and it has also been supporting. Like I said, since the funding support ceased from the global health supply chain about a year plus, the state has now been funding that, and that is why we are able to have that reports going and then resupply being made.
When the support we were having from global health supply chain lapsed by May last year, it was incumbent on the government now to fund that program. So we applied and secured approval from the commissioner, the Honorable Commissioner of Health, that a percentage of incentive from the Drug Revolving Fund be allocated to the LMCU, primarily for data collection and, of course, for every other activity the LMCU might deem it necessary to put such funds into. So to that extent, the government has been made to be aware that this has come to stay. This has to be funded because there's no going back.
We are so grateful to the US government. We are so grateful they have done so well. At least all the support they have given to us, we really appreciate. The US government are doing very well. Like I said, their support technically, the support financially, the support in terms of capacity building. So they have done so well. We so much appreciate what they have done to the state government. Commodity availability, the huge amounts. So we really appreciate what they have done. At least that has gone a long way to improve the health outcome of the people of Akwa Ibom State and those that are living here in Akwa Ibom State and the entire nation. So we appreciate the US government for all their support that they've given to the state. And we want to be like Oliver Twist, so we continue to have more support from them. And the state is very much ready to give accountability. And already, like I said, you have seen that the state have also taken sustainability and ownership as regards supply chain, which leads to the last mile distribution of health commodities to our health facilities. Thank you.